Hey guys, it's Trevor Lang with Peak Potential Physiotherapy and Wellness here. Going live to answer some questions that we got from our blog and emails that were sent out this week. It's in regards to pain and aging with pain and other things along those lines. I'm hoping this is recording. We'll see if I did it correctly this time or not. So again, this is Trevor with Peak Potential Physiotherapy and Wellness. We've been here in the Collierville area for a little over a year now and glad to be part of the community. I have been a physical therapist and in the healthcare realm for over 10, 12 years now, and I've worked with anyone from athletes coming right off the field to people in chronic pain. So it's not something that haven't dealt with before. So the blogs that we have come out with this week, and please let us know if you have any suggestions or things you want us to discuss with you, were about aging without pain. So the first one was 6 strategies to age well without falls or pain. And then we also were talking about nutritional strategies to decrease pain and inflammation. That title was the top 5 nutritional strategies to reduce joint pain. So I wanted to go over the first one with the 6 strategies, and then we're going to delve into the questions that we had gotten. And again, please feel free to come on live or put in the chat any questions that you may have. I'm also going to be putting on the underneath the links to those blogs if you have any specific questions that you would like to have answered. So as far as the 6 strategies to age well without falls or pain, that is something that I have found with a lot of my patients, not necessarily recently, but when we actually ask, is there's a fear of falling, because with a fear of falling comes a fear of breaking something, and then a fear of surgery, and then a fear of losing your independence and lack of mobility and activity, and those are things that no one should ever have to live with. So the 6 strategies to try to age well without pain or without falling. The first is to train aerobically. Obviously this is just getting your heart rate up. You can do that just through walking, through going to the gym, through joining a group, anything like that. Number 2 is to optimize your balance skills. People always tell me that, oh, I just don't have good balance. Balance is a skill, and with any skill it can be trained and increased and made better. So you just have to train that. Something you can do very easily is stand on one foot and hold on to something. You should be able to stand on one foot with your eyes open for a minute without losing your balance. And for your, this is a little difficult for a lot of people, but then to stand on one foot with your eyes closed for 30 seconds. And then that will show you how your optimal balance is going and if you need to increase that at all. There's a lot of different things that can increase balance. Dancing, those sorts of things that can always increase balance. You can also have different tests that will show you where your balance capabilities are or you're at risk for falls. That's all things that a physical therapist could do for you if needed. Eat a nutrient-rich diet, meaning that you just need to have the right stuff in, garbage in, garbage out. 4 is stretch your body, making sure that you always keep your muscles stretched out, loosened up. We had a patient in this morning, chronic lower back pain. We've gotten her out of pain, but she's just not moving correctly. I mean, she's in her mid-80s, loves to go to water aerobics, she's very active, but she's just not moving better. We got in and identified that her hip flexors and her quadriceps, the big muscles in the front of your legs, were really, really tight, and that kind of kept her bent over, and she was sitting a lot too. Stretching those out, she got up and felt much better. That decreases the tension in your spine because those muscles will go through and they attach to your lower back even though they help lift your hip up. So stretch your body. And decreasing stress, everyone's favorite, especially at the beginning of the year. Everyone, it's like one of those resolutions, like needing to go to the gym. You know, you just want to be able to decrease stress. So exercise is one thing that'll obviously decrease stress, increases endorphins, the dopamine response, those sorts of things. We want to get those naturally versus synthetically if you can prevent it. So I'm going to get down to some questions. Again, please let me know if you have any questions. We were talking about pain. I see a couple people on there, so if you can put in the chat if you have any questions or comments about questions about pain, let me know. So to go through some of these, we hear a lot of people talk about chronic pain. So they wonder what chronic pain is and how do I know if I have chronic pain. So there's the diseases of chronic pain, such as chronic fatigue syndrome, fibromyalgia, some of the myositis. All those are chronic pain. Your body is in pain for a long period of time. If we get down to definitions, the way we look at it is anything that's over 2 to 3 weeks. I know it doesn't sound like a whole lot, but anything that's over 2 or 3 weeks is chronic. We'd love to get people in the acute stage, which is the first couple weeks after an injury or after you originally have pain. But when we get people, they have gone through what we call the inflammatory process. When you've gone through the inflammatory process, then that means you have become chronic. And chronic just meaning that your body has gone through the natural healing process. So that's what I'm going to stick to when I talk about chronic pain, is that you're past those 2 to 3 weeks. That is truly your body's healing process has already occurred. So if you have pain that's lasted longer than 2 to 3 weeks, in our minds that has become a chronic pain issue. And what goes on is the body actually starts firing the patterns in your head differently. So different pain sensations, sensitivity to certain types of things, your balance, and what we call proprioception, which is your body's sense in space. All those things are going to be a little off, and those can be retrained, but they need to be dealt with by a professional. So that is the difference between chronic pain and regular pain for my standpoint, as opposed to having a chronic inflammatory disease, which is a rheumatological disease, such as rheumatoid arthritis, something like that we're not going to change, but we can really help with that pain and how to deal with it. But for us, anything over 2 to 3 weeks is chronic pain and needs to be dealt with because the body has not healed itself correctly. Okay? So what's the difference between pain and just soreness? No pain, no gain, right? So that mantra came about through weightlifting. So no pain, no gain is when you are training, not necessarily just weight training. It could be any kind of exercise, because if you run, obviously I'm not a huge runner, but if I went and ran 5-10 miles, I would be very, very sore the next day. So when there is something you did that equated with the soreness, that is soreness, not necessarily pain. That's also can be termed what's called delayed onset muscle soreness. That will last 24 to 48 hours after an activity has been performed. I mean, it could be as simple as going on a long hike, or now that it's nice out, people are out cleaning their yard, their back is sore. Now, if that lasts for more than 48 hours, it could be an indication that you have an injury, something you did, you overexerted yourself and something got a little stuck or a little tweaked, and that could be painful. So that would need to be treated by a medical professional, and you can actually come in to see a physical therapist with what's called direct access, meaning that you don't have to go see the doctor first. So if something like that happens and it doesn't go away in 24 or 48 hours, you give us a call and we can talk you through that process, or if you wanted to go see the doctor first, that is fine as well. But that that is what we are. We're musculoskeletal specialists, we're movement specialists. We're able to see what is going on with a musculoskeletal, or basically a body issue. If it deals with muscle, joint, nerve, disc, all those things are within our realm of treatment, and we can deal with those before you have to go see the doctor. So that's the difference between pain and soreness. Yes, and you might want to work through soreness, because that can move that soreness back into your circulatory system, which is basically metabolites that have kind of formed, that have stayed around in the muscle from the activity that you've done. If you hurt yourself, like tweaking your knee, how long should you expect to have pain? So that goes back to what is chronic pain. So let's say you tweak your knee. You go out and you're running with your kids and being active and doing all the things that you're supposed to be doing, but you turn and you tweak your knee. First thing, there's some controversy around it still, but I would ice it, and I would ice it for the first 3 days, first 72 hours. Maybe some compression. Use a little sleeve, not necessarily one of those big honking braces, but a little sleeve or an ace bandage to give a little compression. Then, if you start moving it and it's just not feeling right, it's still swollen, you can't bend it all the way, it's an indication that something is wrong. So your body has pain because there is something wrong. If you know you tweaked your knee, if it wasn't a pop or a click or something that made the leg buckle, then I would say that is probably a sprain or a strain and should get better. However, the point of physical therapy is we get you better faster. So with you tweaking your knee, I would ice it for 48 to 72 hours, use some compression, and then start trying to move it. And if it doesn't feel good, then you would seek some help, be it just taking some anti-inflammatories, calling the doctor, or for me, I would call a physical therapist, or I have a great one here that I can come see, and I know that he'll get me back on track very quickly. So next one is any type of pain normal? It's all on someone's perception. So does someone consider soreness pain? Then yes, that sort of pain / soreness is okay. I did a workout that I hadn't done before and was doing a lot of kicking and other things, and I sat down and I was stretching with a client yesterday, and some might have called it painful, but I was very, very sore and uncomfortable in my glutes and my hips. So I needed to stretch those out, and after working and moving and doing that, it felt better. So that sort of pain is okay. But the body is trying to tell you something when there's pain. It's like, well, if you touch a hot stove, yes, you have pain, so you can move your hand. Everyone's tolerance of pain is different, so everyone says, well, I have a high tolerance or I have a low tolerance. It's all subjective to that person. It's a great book that I just read, just kind of talked about everyone has different thresholds of pain just genetically. There's some people that don't feel pain, and it's just a difference in genetics. So it's to your tolerance, and if you're equating soreness with pain, I would say that is okay. You just have to work through that. If it lasts for more than 48 hours, or then if you're wondering if it's chronic, then that's after the 2 to 3 weeks. Should I still exercise if I have pain? Like the no pain, no gain. So going back to what we said before, if you feel that it's sore, or if you have limited range of motion, and that just means that limited range of motion, I can bend my elbow all the way. But if it hurts so bad that I can't bend my elbow, I shouldn't go and try to do bicep curls, because I have limited range of motion or limited movement. So I would not go exercise in that fact. But if it's like painful in the muscle and it's just because I know I did a hard workout 2 days beforehand, then I would go ahead and try it and let the body tell you. Not no pain, no gain, but let pain be your guide, okay? Soreness is okay, but let pain be your guide as far as progression. So I have a runner that I just saw on Wednesday. So she's been out for 8 weeks. We just got to her in the last 3 or 4 weeks, so we weren't seeing her that whole time. But she was saying she couldn't. First, she said she couldn't walk without pain, and we got her to the point of being able to walk without pain. But she's a runner who's usually doing 3-5 miles every other day, so this is not her normal. Then we got her to the point where she's like, wow, everything feels pretty good. She got on the treadmill and she was good enough not to keep going. She was on there 5 minutes and realized, okay, I'm not hurting, but I don't want to push it because we hadn't progressed her and trained her to start doing that correctly. So then we talked about an interval program and progressing that way. So that's where you let pain be your guide. You can work through soreness, but with pain you want to be careful because the body is trying to tell you something. Okay? So those were the questions that we received about pain. Please, again, comment or leave any questions underneath the video. I'm going to link to the blog post that we did earlier this week underneath the video. Again, they dealt with aging without pain and the nutritional strategies to decrease pain and inflammation. That second one, which is the top 5 nutritional strategies to reduce joint pain, something you'll want to take a look at. Some things that I've even implemented myself, which is kind of, you wouldn't think would really help, okay? But they do. And this is all stuff that you can get to, but we have links to it in the blog, as well as if you have any questions nutritionally in that regards, we have that help at the clinic as well, or we get you in touch with the right people. We have a physical therapist who is also nutrition certification as well. So, hope y'all enjoyed it. I hope you all are having a good week and enjoying this crazy weather we had from 20 degrees, or actually like 5 degrees to 60 or 70 degrees. So I plan to be doing a lot more of these, so please, anything that you want for me to discuss in the future, please let me know. Thank you.